Basic life support, or BLS, is intended to slow or prevent damage to an unresponsive person until advanced care becomes available. The goals of 2 rescuer pediatric BLS training include initiating the pediatric chain of survival, learning CPR, how to use an AED, and how to work within a resuscitation team. In this video, we will demonstrate how 2 rescuers respond to a child in an emergency situation. Watch the video Part 1 CPR BLS for the child to review the BLS survey if you have not already done so before continuing with this demonstration. In pediatric 2-person CPR, one rescuer will perform the BLS survey and begin CPR after determining that the child is unresponsive, while the second rescuer activates emergency response and retrieves the AED. Once the second rescuer has returned, they will assist the first rescuer in performing CPR. Begin CPR by locating the end of the child's sternum where the ribs come together on the chest. Place 2 fingers on the tip of the breastbone and the heel of the other hand above the fingers for proper placement. The first rescuer will deliver a cycle of 15 compressions with one hand, pressing 1/3 of the depth of the chest at a rate of 100 to 120 beats per minute. Allow the chest to recoil entirely between chest compressions to allow the heart to refill. Meanwhile, the second rescuer will place the bag mask over the mouth and nose, creating a tight seal with the mask using 4 fingers of one hand around the top and the other hand's thumb around the bottom of the mask. They will then tilt the head and deliver 2 breaths for every 15 compressions, watching for the rise and fall of the chest. Do not overventilate. Continue for 2 minutes or 5 cycles and switch positions so as not to tire out. If an AED has been retrieved, have one rescuer power on and prepare the kit, while the other resumes CPR. For children younger than 8 years old or weighing less than 55 pounds or 25 kilograms, choose the pediatric pads or key depending on the machine. If the pads overlap on the chest, place one at the center of the chest and one on the back. Be sure to remove clothing to ensure good contact. Attach the AED to the pads. When prompted, clear your hands and allow the AED to analyze and follow the instructions. Clear away from the child while the AED analyzes. If the AED prompts to deliver a shock, warn others to clear the child before activating the shock button. After the shock, resume cycles of 15 chest compressions and 2 breaths, following the prompts from the AED until EMS arrives or the child's condition normalizes.
If you enjoyed this video and would like to learn more, check out our MedicalProCerts video library on YouTube. Or, if you would like to certify in ACLS, BLS, PALS, or CPR, simply register and certify online today at www.medicalprocerts.com.